Welcome everyone in the hospital online training program. This is Amir Aziz, the medication safety officer in the hospital, and I'm going to cover with you the medication management ESR standards. We will cover high alert medication, hazardous medication, look alike, sound alike, and medication error reporting. Please make sure that you take the post test at the end of this presentation. I will start with this example. What do you read in this prescription? Is it Coumadin or Avandia? Let's guess. Many of us will say Coumadin, others will say Avandia. Actually, it is Avandia. Let's go to the other example. Yes. What is the dose of insulin? Is it 6 units or 60? After a while, the vast majority will say it is 6, and the physician just wrote U instead of units. Yes. But did you notice that I said, let's guess? Is it okay to guess with the medication? Definitely no. Never assume, always confirm. So we need to confirm with the physician, with the one who prescribed this medication. What is this medication? What is the dose of this medication? Either you are a physician, you're a nurse, a pharmacist, pharmacy technician. Please always confirm. Okay, let's start with the definition of high alert medication. What is the definition of high alert medication? Yes, drugs that bear a heightened risk of causing significant patient harm when they are used in error. So please memorize these three keywords: heightened risk, significant harm when used in error. And I will give you two scenarios to make it clear for you. Let's suppose that you are going to commit an error with the same magnitude in the two scenarios. The first scenario, you are going to give 10 times the dose of paracetamol injection. The doctor prescribed 1 gram and you are going to give by mistake 10 grams. The other scenario, that you are going to give 10 times the dose of insulin, 30 units. So what will be the insulin dose? Yes, it is 300 units. I think now we can imagine which more risky. Sure, the insulin. The patient may die because of hypoglycemia. Still, the patient may be harmed with the perfalgan dose 10 grams, but it's not as risky as the insulin dose. Here, the ISMB list of high alert medication. ISMB is the Institute of Safe Medication Practice. They define some of the medication as high alert medication. You will find here anticoagulant, you will find opioids, chemotherapy medication, and many other medications. One of the most serious group of high alert medication is concentrated electrolytes, and here we have some examples of concentrated electrolytes like potassium chloride, hypertonic sodium chloride, potassium phosphate, and potassium acetate. These medications require even extra precautions, and in most cases, this medication needs to be diluted before use. Here we have some statistics. This is the top 10 medication reported as causing harm. We will find insulin, morphine, hydromorphone, heparin, fentanyl, and all of these medications are high alert medication. As well, half of the preventable adverse drug event involve opiates, which may cause respiratory depression, insulin, which may cause hypoglycemia, and anticoagulants, which may cause bleeding. Here we may notice the financial loss of such adverse drug events. Let me share with you another example. It's about insulin as well. Here, this insulin, 100 units per ml, total vial is 10 ml. Straightforward. It's not that vague, but let's imagine how the error may happen. The nurse interpreted this stock volume of Lantus as 100 units per 10 ml, and the dose was 90. Just imagine that the nurse administered 9 ml to the patient. The patient received 900 units of insulin instead of 90 units. These errors are happening every day and everywhere. Anyone may commit such errors. After a long journey with the cancer, Emily was scheduled for her last chemotherapy dose, and she would be coming home cancer free. Emily would finally be able to live as a normal 2-year old. Tragically, that never happened. A pharmacy technician that had been working for the hospital for a number of years decided not to use a standard prepared bag of sodium chloride solution with less than 100% of sodium chloride. Instead, the pharmacy technician filled the plastic bag by mistake with a concentrated sodium chloride solution of 23.4. Once a medication administered, Emily passed away. So, what are the strategies to minimize the risk? First of all, we need to establish a multidisciplinary policy. All the stakeholders should be involved in establishing this policy. Physician, pharmacist, nurses. We have to establish a list, and the list should be detailed by name of the medication, not only by group. Please access the hospital list from the quality portal to be more familiar with the high alert medication list, as this list should be updated annually. We have many strategies, and all of these strategies are efficient. We will discuss today the minimum strategies we have to implement to ensure the safety of these high alert medication. The first one is limiting the access to high alert medication. Limiting the access to high alert medication includes only authorized persons can access high alert medication. Only authorized persons can prescribe some of the restricted high alert medication, like the chemotherapy medication. Not all and everyone can write such medications. As well, one of the aspects of limiting the access of high alert medication that the concentrated electrolytes are not accessible in the regular patient care units, only in the critical care units. As well, if the hospital and the pharmacy department has the capability to provide the medication and to prepare and to provide these concentrated electrolytes in a time manner, then please don't allow to keep it in the critical care units. Once we said limiting the access to high alert medication, we need to maximize the access to the information. We will maximize the access to information. All the healthcare providers in the hospital have access to the policy and procedure through the quality portal. As well, all the healthcare providers have access to lexicon up to date, as well the Dalla Hospital formulary. All of these are valuable resources. Standardize. We need to try to standardize the process of prescribing, preparing, dispensing the high alert medication. We have the IV guidelines, either for the pharmacist or for the nurse, to standardize the preparation process. Please get benefit of these standard concentrations and utilize it whenever you prepare high alert medication or even other medications. Differentiate items. How we may differentiate items? Yes, we need to affix auxiliary label to call attention to important information. And we have this nice yellow high alert label. Redundancy. One of the aspects of redundancy that we are conducting independent double check for selected types of medication, like high alert medication, and it should be limited to ensure the efficiency. Now I am done in a hurry with high alert medication. But what is hazardous medication? Are the hazardous medications have the same concept like high alert medication? In high alert medication, our first concern is about the patient. Here, with the hazardous medication, our first concern is the healthcare provider with the patient. So, drugs considered hazardous include those that exhibit one or more of the following characteristics in human or animal: carcinogenicity, teratogenicity, reproductive toxicity, organ toxicity, and genotoxicity. So the healthcare providers are exposing daily with numerous number of hazardous medication, and the old concept that only chemotherapy medications are hazardous. But now this is not the story. Many medications are hazardous, not only the chemotherapy. For sure, the chemotherapy medications are the most dangerous medication, but still there is other medication may affect the healthcare provider or the patient who is handling these medications. Again, we need to establish a multidisciplinary policy. We need to establish a list of hazardous medication available in the hospital as well. We need to update this list annually. We rely on NIOSH 2016. We developed this list of hazardous medication. It constitutes of 3 tables, table 1, table 2, table 3, and there is one extra table in this list to explain what is the safety precautions you need to take whenever you're handling these hazardous medication. So in general, we need to wear PPEs. The type of PPE will be different according to the type of manipulation of this hazardous medication. We need to label the hazardous medication using the spill kit in case of any spill, and to utilize the safety data sheets for comprehensive information about the substance you are dealing with. Then we will go to look-alike, sound-alike medications. Look-alike, sound-alike medication, it is medication with generic or proprietary names that look or sound like other medication names. Confusing medication names may lead to potentially harmful medication errors. And I will share with you some of the stories. Patients died because of this look-alike, sound-alike medication. So what is this? What do you see in this picture? Yes, it is a frog, but is it very clear for you? I think no. For me, no, it's not clear. It's not that clear. As well, the error associated with this look-alike, sound-alike medication is latent, like this frog. Let me tell you a story about these 2 vials. One day, a young lady came to the ER department in a hospital postpartum with the signs and symptoms of hypoglycemia. The physician checked her blood glucose level. She is hypoglycemic. Directly, the physician prescribed dextrose 50%. The nurse went to prepare her dextrose 50%, infused the medication. All of a sudden, the patient passed away. They discovered that the nurse prepared magnesium sulfate by mistake instead of dextrose. That day, the healthcare system was not aware how to deal with such errors. They just pinpoint the nurse did the mistake, the nurse should be punished. But they didn't fix any other reasons. Imagine what? 1 year after that, the same scenario happened again. They stopped. We need to fix the system. We need to remove these 50 ml magnesium sulfate 50% from the floor stock as well. We need to change the shape of the medication. They contacted the manufacturer to change the packaging. The manufacturer refused. They changed it. The supplier. With these 2 different packaging. Since that day, that error never happened again because they fixed the system. Then we have these 2, vicronium and vancomycin, look-alike vials. Just imagine, as a physician, if you prescribed your patient vancomycin and the pharmacist dispensed vicronium instead of vancomycin. What are the safety strategies to prevent such errors from happening again and again? We need to establish a policy. We need to establish a list of look-alike medication and a list of sound-alike medication. As well, update the list annually. If you are a physician, use brand, generic, and indication to prescribe look-alike, sound-alike medication. Always read the label carefully each time you access LASA medication. Separate LASA medication from each other in different shelves. Use tall man lettering. Tall man lettering is like you will capitalize the different part in sound-alike medication to take your eyes. Minimize the use of verbal and telephone order for LASA medication, as well differentiate LASA medication by affixing auxiliary label look-alike, sound-alike. Here we reach it to the medication error. If the errors happened with all of these precautions, how we are going to deal with these errors? What are the types of medication errors? Prescribing, transcribing, dispensing, administration, monitoring, or any other error related to the medication management process. Why you need to report errors? A problem shared is a problem solved. Importance of medication error reporting. Learn from others' mistakes to collect and analyze actual and potential medication errors, establish strategies to prevent the recurrence. So it is not to pin the point, it's not to blame. It is like two ways learning process. So which kind of errors shall be reported? All errors or events associated with the medication management process either reach the patient or not. The analysis, it's like fact finding, why that happened, how we may avoid the recurrence. Here, like a flow chart, when a medication error happens, what we have to do, either reach the patient or not reach the patient. But make sure if the error reaches the patient, the first thing to do to notify the physician. And this error should be documented in the patient's medical records. When we should report medication error? Medication error shall be reported within 24 hours via medication error reporting system. So any error related to the medication use shall be reported in the medication error reporting system, not in the incident report. Here, how to report the medication errors. You will access quality improvement, adverse drug event, and you will fill the required. And here, how to review the report. If someone reported error on you, you will receive a notifying message. You will access the quality improvement, adverse drug event. You will go to review errors. You will type the event number, then hit find. You'll find the medication error, hit review, write your reply, choose the possible cause, write the corrective action, and then write your preventive action. The most important thing is to reply on the error. What about the feedback? Why we need to receive a feedback about the reported error? Just imagine if you as a healthcare provider discovered an error, stopped the error, and you invested time, valuable time, to report this error. Then you didn't hear anything about that error. What you will feel? You will feel that your efforts were neglected. So first of all, it is your right to know what happened and why that happened. How we may avoid the recurrence. As well, you need to feel that your efforts were appreciated. By this way, we will ensure that the one who reported the error will be motivated to report errors again and again. So we will discover more errors and we will be able to avoid the recurrence and we will be able to fix our system. My last slide here is the post-test. Please make sure that you take the post-test. It's very important and your attendance will not be accounted unless you submit this post-test. If you have internet connection on your desktop, that's fine. Just hit the link. You will access the post-test. You will fill your name, your ID, and you choose your profession. And you have only 10 questions. Each question, 5 points. And the Passing score is 70. If you don't have internet connection on your desktop and you have internet connection on your mobile phone, just scan the QR code and you will be able to access the test. With this, I want to thank all of you and wish you the best of luck.